Welcome everybody. Really glad that you could join us. We've had a really interesting day today, the second day of the Water and Health Conference, and we're really happy to have an opportunity to share it with you. It's late where I am, but early for most of you. I'm joined here with some co-hosts and some guests. So let me first introduce the panel that is here with us. My co-hosts are Murali and Alison. Would you like to introduce yourselves just very quickly?
Yep, sure. I'll start since I'm off mute and Murali can.
Okay.
So yeah, my name's Alison Baker. I work for a consulting company called GHD, but in my current role, I'm actually the fund manager for the Water for Women Fund, which is an Australian government-funded program specifically looking at WASH.
Great. And Murali?
Hi, good morning, good evening, everyone. My name is Murali Ramasetti. Currently, I am a regional convener for Freshwater Action Network South Asia, FANSA, which is a network of civil society organizations working on water, sanitation, hygiene issues across South Asia, covering about 8 countries. We are a network of more than 400 civil society organizations. Thank you. I'm based out of Hyderabad, South India.
Great.
Thank you.
And thanks to both of you for being my co-hosts. We've also got 4 guests. Ravi, Prashanto, Jan Willem, and Piram. Piram hasn't joined us yet, but I'll ask the others to introduce themselves. Ravi, would you like to start?
Yeah, my name is Ravi Narayanan. I'm delighted to be on this show. I'm currently the chair of the Governing Council of the Asia Pacific Water Forum and the Water Integrity Network. One's headquarters are in Tokyo and one is in Berlin. I myself live in Bangalore in South India, about 300 miles south of Murali.
Okay. And Prashanto, can you introduce yourself?
Yeah, hi everyone. This is Prashanto Roy, working for World Vision Bangladesh for Water for Women Fund as a project manager. Thank you so much.
Thanks. And Jan Willem?
And my name is Jan Willem Rosenboom. I'm based in Seattle, and that's where I work with the Bill and Melinda Gates Foundation as a member of the Water Sanitation Hygiene team.
Great, thanks. And we're hoping that Piram from Cambodia will join us a little bit later on. So let me just, why can't I change my, oh, there we are. Sorry. So this is just how we're going to run tonight's little talk show. It's supposed to be very informal. We've done a round of introductions. We're going to just tell you a little bit about how to access the session resources from the conference today. And then we're going to run through a few highlights of today's sessions, just a few things that we thought were particularly interesting and would be of interest to an audience in Asia and the Pacific. And then with the co-hosts and the guests, we're going to talk a little bit about the relevance of the things that were discussed at the conference for Asia and the Pacific. So let me talk first about how those of you who are on the call can access the session resources if you're in a time zone where it really wouldn't be very comfortable to try to listen to the sessions live. It's very easy to register for the conference if you haven't done it already. It's completely free and very, very quick. And then once you've registered, you can go on to the website. You can go to the agenda and you can find the sessions that you're interested in. You can see everything there. And then once you click on a session, you can see the video and you can watch the video of the entire event. You can also access the chat and you can look at any of the files that have been posted. So we really encourage you to do there. There's a huge, do that. There's a huge amount of content there. So please go in and make use of that. So we'll just run through some of the session highlights. Jan Willem and I have prepared a few slides. He and I attended a lot of the sessions live today. Some of you who are on this call may also have attended some of these sessions. So, and some of our panelists may, so don't hesitate to put things in the chat about what you saw. And for the panelists, if there's something that you'd like to add to my and Jan Willem's highlights, please chime in. So I'll go to the first slide and over to you, Jan Willem, to speak to this one.
Thanks, Clarissa. This being the late show, I keep waiting for you or anybody else to tell us a joke, because
Yes,
these shows are supposed to be funny,
joke.
right? The sessions weren't particularly funny, but they were really, really interesting. And in the financing for WASH, I saw 3 sessions. One run by Barbara Evans at the University of Leeds about her cactus, the Cactus program, which is a program that is collecting data on cost for a whole range of different sanitation systems and the cost of moving shit around in trucks or pipes. And she was talking about the database that she has set up across all the technologies in cities. And she ended with a call, which you can see on the slide there, asking for collaborators, for institutions and individuals that are interested in helping her expand the database with technologies and costs, or want to collaborate in another way on that project, to please write to any of the researchers and collaborators listed on that slide and let them know. So I wanted to make sure to point that out. And if you want to know more, then you should download the presentation from the resource section. There was a second presentation, a study of costs done in Kisumu, but that's the same presentation that emerged later in the sanitation verbal session. So I'm going to skip that one and talk about that later. And the third and last Finance for WASH session was about innovative financing for sanitation, which is an incredibly complex landscape, but basically covers 2 purposes. One is bringing more money into the sector, and the other one is increasing efficiency and effectiveness of projects. And that's where the presentation really focused and said, look, before you do any of this, and that was an important observation, make sure that you understand what you want to do and then pick a tool. Don't pick something innovative, financy, because you want to be innovative and new. Know what you want to do and then use the tool that's available. And the other way to put that is like a friend of ours in the World Bank once mentioned that, or summarized it. He's like, in financing, there's 2 approaches. There are the approaches that work and those that don't. And with the innovative finance, don't get sucked into wanting to be new and innovative just for the sake of it. And then they ended with a presentation of a development impact bond that was structured in Cambodia to deliver sanitation through a sanitation marketing program, which is a great example of getting to scale. And if you're interested in that, I would really encourage you to go look at that presentation.
Okay.
And I think you can move on from there.
I can
Clarissa.
move on if only I can get my screen to behave. There we are.
So the serving the urban poor was also consisted of 3 sections, but I only saw one of them, and that was really the presentation of 3 tools. One set of tools was published by the Knowledge to Practice project, and if you Google K2P, the K, the numeral 2, and then P, you will find the tools online, and they help you map contamination of the environment, develop sanitation and waste treatment options for pathogen kill. And on the site, there's also interesting case studies and other materials. The second tool that was presented was SaniPath, and you see that one in the slide, which begins with the shit flow diagram, which probably doesn't need a whole lot of explanation to anybody on the line anymore because it's been around for a while and is well understood. But it gives you an idea of shit flow, fecal flow at city level and what goes back to the environment. And SaniPath couples that with a behavioral tool to understand pathways in the environment that then helps answer questions about how the fecal contamination affects people and leads to disease.
Oh, sorry.
The third, that's fine.
Rush you.
That's fine.
Okay.
Keep going. I want to do this a little bit quickly so
Yeah,
we can answer questions and have discussion. I think that's much more useful than me blathering on about all these presentations, although all of them were really interesting. So I'm just trying to touch on a bit of a flavor. The JMP update presentation was really focused on washing schools. And they presented case studies from Mozambique, Zambia, and Berlin, even about washing schools, and highlighted the data issues that exist. It's really hard to get clear data at country level about this. They published the new JMP report on washing schools and shared the core questions that can be downloaded from the JMP sites for countries that want to, or schools that want to collect their own data. And then the session where I came in were 3 panel presentations, kind of looking at how to improve washing schools, how to make good use of the data that exists to actually drive better decisions. And the examples there were one presentation about called Blue Schools, schools that really improve on sanitation, but then also look at solid waste and integrating material into the lesson plans to teach students about the importance of all this. There was a presentation on nudges. How do you get kids to behave and wash hands in schools around improved sanitation facilities? And you see some pictures here, you know, soap with little dolls in them, or pictures of bacteria on the lock that make people want to go wash their hands. And there was interesting information about the Wash in Schools Global Network, which has a resource page on the Susanna website, where there's a lot of tools and materials bringing different actors and useful information together. Next slide.
This is me.
That's you, great.
It's me. So this is a session that, full disclosure, I was involved in helping to organize. It involved quite a few people. And it was looking at the failure of wealthy countries to reach all of their citizens with water and sanitation. And we looked at the prediction of whether or not high-income countries like the United States in particular, but also Canada, where I'm based, were going to be able to reach SDG 6. We had some interesting voices from vulnerable communities. The photograph there is a woman that I know called Cecilia Brooks, who is a water grandmother with the Mi'kmaq indigenous communities here in Canada. And we had some interesting data on how far we've got to go, particularly in the US, in terms of achieving water supply and sanitation for everybody. This is a graphic on plumbing poverty, the number of people who don't have a plumb connection in their house. We had some breakout groups in which we talked about some of the solutions that are going to be required, many of which have nothing to do with technology and are very much to do with being able to identify vulnerable communities and find ways to empower them to achieve water supply and sanitation. And then that had an interesting link with another session that took place in the middle of the day, which was on the actions of the US government. And it focused in particular on the US government's aid allocations to water and sanitation. But it also had this slide in it, which was looking at the lack of access among Americans to water supply and sanitation. And also this issue of affordability, showing that the price of water supply and sewerage connections has gone up significantly over the last few years, and that large proportions of certain communities are now finding them unaffordable. And then, of course, also touched on some of the well-known water quality problems. So these two sessions were very, very, very thought-provoking. And then, Jan Willem, we're back to you.
Okay. Yeah, it was very interesting to see to see that midday session on how big the problems in the US really are. And so in the policy and finance session, I attended one of the presentations that's about Fresno in California, and the general plan and the law that exists, how about how the county needs to be aware of underserved populations and the needs in water and wastewater. And I would say, for the purpose of this discussion, forget about the fact that it was in Fresno. What was interesting about this presentation is the fact that you have a place, the policy and a law is in place. It's actually not being paid attention to by county government. So they don't really understand what the needs are of the people in their environment. And this particular project brought user groups together to do a health impact assessment and study the needs and the concerns of the community, then had them involved in sampling water and soil that they tested for particular bacterial exposures. They developed an exposure model, did a full QMRA model, and wrote up all the information and presented it to the county to pay attention to in their planning and pay attention to in the law. And I would say, whether that's in Fresno or in Delhi, that sequence of events where you have a government requirement that's not being met, and you involve local communities and your scientists to provide the sort of information and update to get action on policy, was really, really interesting. So if you read it through those glasses, it's an interesting study of what's possible in that way. And also in the policy and financing session was a presentation that looked at inline chlorination of drinking water provided to slums in Dhaka. And that really consisted of providing a chlorine doser on hand pumps, and then interesting landlords in actually paying for them. And the study itself was a complex data collection process on different ways of measuring willingness to pay, the drivers of demand and uptake, and the basic conclusions here that were that particular approach compares favorably to point of use treatment that you can use in the house, or manual dispensers, which also have been tested in Bangladesh. But it really is better potential among middle income consumers just because of the cost of operation. And what they would have to do is test it at a much higher scale to see if they could make better use of the human resources you need to maintain the system, keep it filled and stuff like that. And the demand over time drops off, which was kind of compared to it's like joining a gym. When you join a gym, you're already just like, I'm going to do this, I'm going to pay my monthly charges. And then over time, you see yourself kind of go like less and less and less, you become less interested in paying. That's the same that happened with the landlords paying for clean water. And then the final presentation here, next slide, was the study I mentioned a little bit earlier that was done in Kenya, Ghana, and Bangladesh, looking at what needs to happen, basically financially, to get full sanitation service by 2030 in among low-income communities in these three countries, a number of cities in each country, looking at a whole different variety of technologies, from lined pits with informal manual desludging or vacuum desludging, sewers, container-based sanitation, biofill toilets, and basically came to the conclusion that in all these communities, there's no way that the households themselves are able to pay for what it takes to do this. And what the project did that was innovative was break down the cost in the, sort of the infrastructure investment that is needed for each of these environments, and that's the white bars that you see on the graph. And then the cost that would need to be subsidized by the council or the city, because you would need to cover the expenses that the users themselves would not be able to cover. And that then that way of presenting data then gives you a way to discuss what financing instruments you can use to provide the subsidies and to invest in your infrastructure, and how you make decisions about that. I don't know, Clarissa, whether you wanted to say anything about that You were in that session as well.
Yeah, I was in that session, and I thought it was a very interesting discussion about the role of subsidies and sort of budgeting for subsidies. So I would encourage people to go and look at that. So thanks, Jan Willem. That was great. A sort of fast and furious ride through some of the sessions, just to whet your appetite for going to look at more information. I'm going to hand over to my co-host now, Murali, to have a conversation with Ravi and Prashanto about the implications and the relevance of what we've heard for South Asia. But before I do that, are there any of the panelists who want to add anything to what we've said about the sessions? I'm not sure if any of you have had a chance to take a look at them. But now's your chance if you want to say anything or bring it up during the conversation. I'll hand over to you, Murali, to take over the hosting role.
Well, thank you very much, Clarissa and John Williams, for giving such a wonderful overview of day 2 proceedings of the conference. It was indeed very useful to understand what has happened on the day 2 of the conference, and the sessions, particularly which you covered in your overview presentation, are highly relevant to the South Asia context. In fact, I've been listening to some of the presentations in the sessions and also the videos recorded on the conference website. First of all, I would like to mention that the technology is working so perfect. It is so comfortable to go back to the video recordings and hear to the conference, the conversations and discussions. I would like to really appreciate the effort made to put in place such a perfectly working technology, which is really very comfortable for the global participants to join the conference. Thank you very much for that. I think the important topics you covered in your overview presentation. I think the data bank on technologies is something which is highly relevant to a South Asian context, particularly keeping in mind a lot of smaller towns across South Asia are now making very serious efforts to improve the water sanitation hygiene standards in the smaller towns where there's a lot of demand to know technologies. I think from that point of view, I would definitely say that the outcome of the session would be highly relevant to South Asian context. Similarly, financing for WASH, where in South Asia there's a lot of emphasis on evidence for generating the results and accountability for the budgets allocated in the name of WASH, how the money is being spent, and similarly the efficiency of spending. So there are a lot of other aspects that you touched upon which are very highly relevant to South Asian context. Similarly, the whole issue of serving the urban poor. We are making very good progress in South Asia, in bigger cities, when it comes to reaching water, sanitation, hygiene services to the people. But the services, particularly in the poorest neighborhoods of the urban areas, is not on par with the rest of the cities. That's where ensuring equitable and inclusive progress on water, sanitation, hygiene in urban areas is a big challenge. Our governments are grappling with that issue, and there is a great amount of receptivity to look for scalable approaches and solutions in South Asia context. From that point of view, I'm sure the deliberations of this session would be very useful for us in South Asia. Similarly, in WASH in schools, I think we have crossed a phase where there was inadequacy of infrastructure as a big issue, but now more or less in terms of creating infrastructure, a great amount of progress has been made. But the main challenge now is how do we really find sustainable approaches for ensuring operation maintenance and protecting the capital investment, etc. So those are the issues as far as WASH in schools is concerned. I think it would be very interesting to get connected with that global network on WASH in schools. Similarly, sanitation financing, estimating the kind of investment required for citywide sanitation, budgets required for operation maintenance and protecting the capital investment. I think those are the issues which are very relevant in South Asian context. We are making a lot of investment for improving sanitation infrastructure, sanitation services in the urban areas. But I think sustainability, operation maintenance is a major issue. So from that point of view, I'm sure the discussion that have happened in the conference will be very useful to us. So those are very quick reflections from my side. Now I would like to invite Ravi Narayanan to share his reflections on the overview shared by Clarissa and Jim, and then relevance of that to South Asian context. And probably he can add his own views on the topics that were mentioned in the overview. Thank you. Over to you, Ravi.
You're mute. You're muted, Ravi.
Yeah, so thank you, Murli, and thank you, Clarissa and Jan William, for your presentations and for your comments. From the South Asian perspective, what strikes a person living here is a sheer scale. You know, you're not talking about millions of people, you're talking about hundreds and tens and hundreds of millions. Yesterday, there was a conference in Belgium, GSTIC conference, at which the Joint Secretary to the Government of India was talking about a program where the Government of India wants to extend sanitation in 500 cities to a population of 360 million people. I mean, these are all mind-boggling. When you have numbers like this, one tends to, I mean, the natural instinct is to go for rough and ready solutions, you know, and not the finer points of detail. Now, but it is the finer points of detail that often are very, very important in terms of quality and so on. So fecal sludge management, for instance, great. But fecal sludge management in very densely populated informal settlements poses a set of technological challenges which are quite different from widely dispersed settlements, right? So one's got to think about those things. I mean, it's not that it can't be done, but I'm saying that it needs much more thought. One other point that I'd like to make quickly now is that we talk about waterborne contaminants, but COVID has told us about airborne contaminants. And this is where, you know, the classic solution of community toilets and community tap stands and wash stands can actually be sites where you have mega spreader events, right? So how does one overcome that? Have we invested in public space design, for instance? Are we involving design principles and architectural principles in making sure that there's proper isolation, social distancing, and proper washing of hands, et cetera, before common facilities are used? So these are questions that we have to think about, and they're often brushed under the carpet because nobody raises them. One final point, you know, the point about the US where there is Fresno, I think, where there was legislation, but no action because there was no demand. Why is there no demand? Why are people not protesting or raising their voices? I mean, that's another issue that needs to be addressed. I'll stop now. I haven't offered solutions, but I've raised questions about emphasis that perhaps we can talk about.
Thank you very much, Ravi, for sharing your comments and what has been covered in the overview presentation by Clarissa and Jan. Now, I would like to invite Prashant to share his comments.
Thank you, Murali. Thank you, everyone. Yes, the presentation given by the Jan William and Clarissa is the perspective in Bangladesh is relevant to the presentation. Because of that, COVID-19 teaches to the global leaders, especially the political leaders, they need to think about the more financial investment in the water, sanitation, and hygiene practices. In Bangladesh perspective, if we consider the facility, especially the menstrual hygiene management issues, this is the negligible issues. Our people, our leaders are not much more think about the contribution of the financial issues and also the sustainability issues. If I think that the several study in Bangladesh, I can refer to the National Hygiene Baseline Survey in 2014. They shown the report shown that Yes, there is a lots of gap regarding the menstrual hygiene management issues, particularly in the schools. The students are not get access to the accessible facilities at their schools. During their menstruation period, they are missing the school 2 to 3 days per month, and also they have no the availability of the facilities. I mean that the pad and other changing of the pad and disposal systems. In our country context, also another issue is there the if there has the facilities, they have no the big question of the accessibility. Accessibility for girls with disability, accessibility for the women with disability. This is the prior time for the thing about that accessibility issues. If we consider the SDG, then leave no one behind. Considering that, we should consider the people with a disability for their access. And also in the infrastructure, yes, in the urban cities, they have the density of the population, especially in the low income settlement areas. We have been trying to improve the water sanitation issues, situation, facilities at the urban settlement, but it's need to go far for investment, for mobilizing the community people and think strategically for how to improve the water sanitation situation in the low income settlement in like the Dhaka cities and mega cities in the Bangladesh. And another issue I want to share that in line with that, yes, fecal sludge management is the big concern in Bangladesh. Yeah, in terms of urban as well as the rural communities. People are not think about that, how can they safely manage the issues. In the small cities, some initiative we observed that some private organization or NGOs are taking the initiative, government also taking the initiative, develop the framework for fecal sludge management, but we need to go far away. So in that case, yes, it's good to for the global leaders, including our country leaders, to think about that how can we go far for to improving the water sanitation and hygiene issues in South Asia as well as the globally, particularly in the Bangladesh, because of that Bangladesh is the flood prone areas. And every year community people are facing the affecting the flood, and their water and sanitation facilities are washed out. Yes, we need to think about the technology for sustainable technology. It's the big question of the technology. We need to invest more for research and development of the technology. That's in from my. Thank you very much.
Thanks very much. That's great. I'm going to hand over now to Alison Baker, another one of the co-hosts. And Alison, just to let you know that Piram is now on the call. He had some internet
thank you.
Yeah, Murphy's Law, of course. Internet problems only happen when you have to get to a Zoom call. And can I, just before you start, can I just remind everybody that if you've got any questions, anything that you'd like to bring up, chat, a joke you'd like to tell, please put it in the chat where we're monitoring the chat. So over to you, Alison.
Okay, thank you. And thank you everybody for an amazing broad range of issues that we've touched on. I must admit, when I was looking at the schedule and what was going to be covered today, I thought, oh, how are we going to capture all that in a short space of time? So I think some of my reflections very much actually relate to that. Just listening to the different presentations, looking at financing, looking at technologies, looking at schools, it's so much the breadth of the sector and all the different aspects of water sanitation and hygiene, both in developed as well as really wealthy countries. It's complex, and there's so many different parts of it, but for me it's really reflected how central it is, the work that we actually do. COVID has really sort of exacerbated that. But if we sort of step back and look at the financing, the policy, the access issues, and in terms of reaching the SDGs, so much of it does involve us working together. I think oftentimes water and sanitation, we thought, oh, well, that was an engineering kind of field, but so much it's evolved into a behavior change field. It's now evolved into a financing field. And when we look at the reaching and leaving no one behind, as Prashanto said, looking at people with disabilities. I know there's been a little bit on the chat, even in terms of MHM, an issue that was sort of put in the cupboard and not necessarily considered very important, is very much sort of seen as critical to getting women in the workforce, getting girls into schools. So while we might start with looking at getting infrastructure and facilities, it starts to have so many sort of broad impacts from there. So I guess those are some of my sort of really key things. Is one, the breadth of the things that we need to address, the areas of expertise that we need to know something about, and we need to really collaborate to find those solutions, and the whole financing issue that I think sort of came through strongly in those presentations. That's something that the Water for Women Fund is starting to look at, and something that I really picked up in that is you don't just look at something like innovative financing for the sake of it. You want to actually look at what you do and finding a model that will work for that. I think so many of these different things is we develop these terms and we develop these fancy things, but in the end, we do need to try and keep it simple, and we do need to very much keep it practical. And in doing that, we can start to chip away at the scale. And I think that's sort of my last comment. Is it's flagged by Ravi and Murali as well, is just the scale of the issues. South Asia is one issue, and there's a whole range of solutions there. But then we move over to Southeast Asia, there'll be a different set of parameters we need to deal with there. And the Pacific is unique again. It doesn't have the population densities. It doesn't have that sort of attractive system, or in terms of, say, bringing in additional funds and bringing in the private sector. So we need to think a little bit differently about how we do things there. So I sort of touched on a range of different points, but I suppose that was my point, is there are so many different things that we need to address, but from my perspective, that's the fun of it. And we get to influence so many different sectors as well. This year's conference looking at water and health, I think the WASH piece is very much, well, we've always known that it has a very strong health component. It's now being recognized internationally as COVID has actually hit. And funny enough, and I'll finish here and then hand over to Piram and see how he wants to continue to add to that. Something that's come up in Australia over the last sort of few weeks is just the importance of something like hand hygiene, which is something that we deal with all the time, is sort of seen and being talked about by people in defence. So all of a sudden we're adding a whole other element to an already sort of complex and interesting sector, where people in defence actually see development, water and sanitation, hand hygiene as something that's actually really important to the work that they do internationally as well. So on that rather random thought and a new stakeholder into the mix, I'd like to hand over to Piram, who works for the water and sanitation area in Cambodia with the World Bank. And I'm sure you have comments that you want to make yourself, Piram, but I also thought if you have any experience with the IDD, USID, sort of Stone Family Foundation, the Development Impact Bond, and any influence that you see in Cambodia, that would be really interesting. That's something we're looking at perhaps using and seeing whether we can take that model and apply that somewhere else in the Asia Pacific. So handing over to you, Piram.
Well, thank you, Alice, and thank you, Clarissa and Jan Willem, for this. It's been my pleasure to join this finally, after struggling with the internet connection 5 minutes prior to the session. So I'm
great
very sorry
to be here.
for that.
Free to be here.
Yeah. Well, you know, like as many others, I guess I don't attend all the sessions, at least, you know, yeah, but at least this morning I tried to look at some of the presentations and sessions, and I found very interesting presentations and the interactions, you know, across different sessions and so on. But before I address the DIB that Alison alluded to, let me say, you know, in this COVID-19 time, I think that there's, of course, there's a challenge for all of us, but at the same time, it also creates opportunity for the WASH sector to move on in the country. And why I say this, because, you know, in the World Bank, we recently prepared the water supply and sanitation project where I'm leading that project. There was a tough discussion, you know, with the Ministry of Finance when it comes to behavior change communications as part of the programs. And you may recall in the BCC sessions on Tuesday, yesterday our time, but this morning for you, is very much around behavior. It's a central part of everything, especially when it comes to WASH sector. But, you know, during this COVID time, there's a lot of talk in the countries about, you know, hand hygiene, about personal hygiene and so on. So it creates a good momentum for us to kind of push the WASH agenda further, and the Ministry of Finance start to buy in how important is this under the project. And now they understand why the bank is pushing really hard as part of the WASH programs to include behavior change communication, especially when it comes to hand washing, because we told them that, you know, providing water supply is not enough if people don't use it for hand washing, and if people don't handle it properly before the consumptions and so on. So that's kind of the key things that I see the relevance of behavior change communications designs and the operational at scales from the conference. And then when it comes to WASH finance, you know, I skimmed through the presentations that is done by the presenters, including Barbara Evans and so on. It's very interesting, you know, it resonates well with what we are trying to do in Cambodia. We are, as part of the water supply and sanitation project in Cambodia, we try to push the agenda on citywide inclusive sanitation, right? So that the government don't see sewer as just the only solution for the cities, but also incorporate the broader sanitation service for fecal sludge management, and incorporate that as a service that they have to provide and so on. And in the past, you know, the government has very much focused on the big sewer system, which is very costly, you know, according to the presentation. I think the cost is as much as 5 to 6 times compared to the fecal sludge management and so on. So now they get some sort of buy-in, and they agree with us to implement this as part of the project, and they will implement this in other cities as we move along. So I think using this costing model would even enhance our argument in terms of convincing why, you know, citywide inclusive sanitation is relevant for Cambodia. And also, you know, irrelevant in the sense that government is now focusing very much around wastewater and sanitation cost recovery in Cambodia, because there's a lot of investment around wastewater, but there's no clear plan on how to recover the cost, how the tariff is being collected. And for this, we are working with them very closely on developing the tariff regulations for wastewater, and combining this, you know, with the fecal sludge management and so on, to provide regular service to the cities as a whole, so that they can see, you know, household as a unit that they have to serve, rather than only the household who are connected to sewer as the one who will benefit from the service and who will be charged. So I think the WASH finance around the costing of urban sanitation would help us to actually bring our argument even stronger on this aspect. Now, when it comes to innovative financings around the development impact bond, of course, I was in discussion with the Stone Foundations and IDE around this at early stage. And I see this is very innovative in the sense that, you know, now that the coverage for rural sanitation in Cambodia has been progressing quite well, it is now time to push a little bit further, you know, to reach the universal coverage. And you know how hard it is to achieve that. You know, it requires a lot of collaborations, it requires a lot of innovations of interventions in the field to make sure that those things are happening on the grounds. And I know the government has put a lot of efforts through development partners and NGOs through pushing that further. And I think this development impact bond will even bring in, the key innovation around intervention to make sure the outcome is achieved, so that the impact payer can pay back to the impact investors and so on. So I think this is quite innovative in Cambodia, and I hope that there will be a lot of lessons learned within the countries, in the regions, and also globally at some point. So let me stop here and see if there's any question. Thank you.
I wanted to quickly react to some of the things you said, Pidum, if I may. Alison, if I
go for it.
can.
Yeah.
So there's a couple of things.
And there's a question as well.
There's a question.
We'll
okay, Alison, you've got the question. Very good.
I've got the question. Yeah.
Okay.
Yes. So Jan,
but very quickly. So the interesting thing is that everybody that looks at the different types of technology to provide sanitation service comes to the same conclusion, right? Like sewer is the most expensive, and there's other options that are cheaper. But even if they're cheaper, the willingness to pay data that we can collect still shows that more money is needed, that even a household that invests in container-based sanitation may still need financial support. That's really consistent. But then on the other hand, you have the people that actually talk to cities to try to collect data on what it costs to provide services, like Barbara is doing with the Cactus Project. And her conclusion is that cities actually can't answer questions about that. They have really little information about what it costs to provide the service, which makes me think that these models that these studies produce are useful, but probably also should be taken with a grain of salt. Like if the cities can't tell us what happens on the ground with what exists, the studies that tell us what it would cost to do it in the future may have to be approached carefully, which is also borne out by the data collection on willingness to pay in Bangladesh, where one of the conclusions was that the willingness to pay study data that comes up depends very much on the method you use to ask the question and to determine what the willingness to pay is. So you should never say, if the willingness to pay is 50 and the total cost is 100, then I need a subsidy of 50 to make up for the gap. There's more research and more work needed to get from an understanding of your costing and your willingness to pay to actual service provision. And so that the themes are all there. I also think that we need to be really careful at how we approach that. And then if you tie that to the question that Ravi came up with, it's like, we're not talking study level, we're talking millions of people that need to be served. And you get into program delivery at that scale and financing at that scale, lots of things may look different again. So lots of interesting food for thought coming out of here.
Yes, definitely.
We should all go tomorrow to all the sessions. Let's look at the questions, shall we?
Yeah, so thanks, Jan, for making those comments. Yeah, it's, from one perspective, it can be overwhelming, but I guess we also have to trust ourselves that we actually can work through a lot of those issues and stuff as well. But the one question I want to come back to, Param, that's been asked is, what kind of arguments and were you able to use with the government in Cambodia to convince them that it's really actually important to finance water and sanitation?
Well, and I think particularly hand washing was the.
Oh yes, sorry, I should have written it down.
The focus of the
right.
question was on hygiene,
Yeah.
behavior change, and hand washing.
It was. Yes, thank you. Sorry, Bronwyn.
Yeah, thank you, and thank you for the question from Bronwyn. Through our engagement with the Ministry of Economy and Finance, we need to put our thought. Sometimes we need to put ourselves in their shoes as well, right? Why they are resistant to one thing. And the reason I'm saying this is that when we prepare the project, one thing that they clearly ask us is about infrastructure investment, right? Because for them, there is a debt management strategy that specifies the productive sector, that need to come in. that need to use the loan for investing and so on, right? I mean, but then when we prepare the project, we need to bring in more evidence and also convincing argument to them that, you know, investing in infrastructure alone does not bring them so far, right? So for me, the approach is so much about you know, leveraging the momentum. So number one is about, you know, using this COVID situation as the leveraging point to tell them that, see, you know, I told you at the beginning that this thing is important. Now you even see how big is this issue, you know, by just leveraging the IDA money, you know, that are taking from us to do a little bit of extra work beyond the infrastructure, you will get the full benefit of infrastructure, right? And also number two, using, you know, some of the evidence from the academia or the journal paper, which I get the benefit from UNICEF, who has the publications around the safe handling of water at home and how important it is. And all of these relate to behavior change at the household level, right? So it's how about you packaging it and try to find the right momentum to kind of trigger that discussion. And I can tell you it's very frustrating discussions. It's not easy because this is a loan. And they keep insisting for a grant to complement this, but they cannot find it. But finally, at least we can allocate some fund, you know, from the project to be able to implement those things. Thank you.
Great, thanks, Param. There's a couple of other, I think, sort of in the essence of time, I might jump to a couple of other questions that are there. And just open it up to any of the panel members to respond to. One of the first questions was just examples that people have from the field in terms of making sure that there is social distancing. I can't quite see the question, or maybe it's, yeah. Here we go. I've got it now. Yep. Any kind of interventions to encourage social distancing and infection control around rural and urban communities, especially when they're using shared facilities such as water points and communal toilets. That, I think it was Murali brought that up a little bit earlier. I know I've seen some photos of sort of circles around some of those stations. Does any of the other panel members have some other experiences of what countries have done around those public spaces?
May I respond, please?
Yeah, sure.
Sure. Thank you, Alison. Well, it's an area where not much work has been done because we think that just providing the facility is enough. But COVID's brought another dimension of airborne pollutant transmission. So proximity becomes a problem. Whereas in crowded communities, the idea of community facilities is pushing proximity to its limits. So I think, first of all, we need investment into examples of public space design where some investment is put into possible design of facilities where there is not just gender-based separation, but also individual separation. That's one. Secondly, the whole thing about how ideas are transmitted. And somebody talked about data. I think it was Byram that talked about data, and Jan William. Data needs to be, we need to understand how data is transmitted. And that is something that we need investment in. I find that a lot of the investment that goes in, particularly from the civil society sector, is actually into service provision, which is useful and important, but it's not enough. So perhaps if we went into what's missing and investment into what's missing, like these designs and innovations, then perhaps, and then how you spread these innovations, we might get a faster spread of action.
Okay, thank you, Ravi. Just looking, there's a few questions, so some of my co-hosts, please jump in as you see them. But one of the questions, and I think this is for Param again, just looking at ODF and sort of universal individual toilets, and looking at the Clean India program, and how that compares, sort of in a sense. Some of the ideas in that are actually being picked up by the Cambodian Development Impact Bond. Just wondering how the hand washing was included in that sanitation impact bond, or was it mainly just looking at universal access to toilets and ODF? So did that development impact bond bring in the toilets as well as the hand hygiene piece?
I'm wondering whether any IDE colleagues is in here, but from my understanding from the early discussions, I understand that the focus was mainly around universal access and ODF. So hand washing was not part of the outcome, at least from my early understanding. But if there's any adjustment to that, I think the Stone Family Foundations or the colleague from IDE may clarify on this. So they kind of pay based on the set target for the communities that they achieve, in terms of the access to sanitation and ODF.
In the presentation about the dip earlier today, the hand washing didn't come up, and it was really based on IDE's scaling up market sanitation, the SMSU program, which also did not include hand washing at the time. So I think that's correct, Biram. That was not part of it.
Excellent.
We do have somebody from IDE who is on the call as a participant, but I think he's also putting in questions. So it's Tyler Kozole, is that right?
Yeah.
So he says, since the launch of the development impact bond in Cambodia, have we seen any uptake or adaptation of this model for new development impact bonds, or similarly mixed investment or donor financing models for WASH? So I don't know, has it been picked up in other places?
I'm not aware that it has, but that's just me. It's something that we're actually looking at Water for Women, whether we actually can apply some of that thinking to another country. So we may explore that over the next bit, depending on interest within the fund partners.
I'm also not aware of any, but I'd love to see somebody do it. I would love to see some of these ideas demonstrated in countries in Africa as well. All the market-based sanitation models that have worked at scale have worked in Asia. And I know we're primarily talking to Asia right now, so round of applause. But just from a personal perspective, I would love to see this.
Excellent. Yeah, I think that would be great. I think that it's been great to see that success, but the trick will then be trying it somewhere else and seeing how that needs to be adapted to that new context. I'm aware we're sort of running low on time, but I might just squeeze one other question in. It says finance for sanitation infrastructure isn't enough. Programs for behavior change is vital, including information, communication, education. What could be the strategies or best practices that have sustained sanitation IEC? Grants are not enough, especially when there's donor fatigue. Sounds like it's in the Philippines. How can we help governments? International bilateral agreements for sanitation must also be focused to the needs. So I think that if anybody wants to have a go at that, but I suppose the point being brought out there is, yes, we need infrastructure, but we need some of those the education programs, hygiene, the behavior change. It is a holistic approach, and how do we try and encourage that? So does anybody have any sort of final comments on that? That was actually quite a big question to finish on, but any final comments would be great.
I think there was also a question about capacity building, and just to layer on to your point, Alison, that it's a big, complicated problem. One of the things that I really noticed from today's sessions was that there was a lot of talk of capacity building, and in fact, this came out during the innovative financing session. Was the fact there was a great quote from somebody who said that even entrepreneurs need to be trained to be entrepreneurs. That there's, even people who are willing to take risks, as entrepreneurs do, in financing things sometimes need to actually have their capacity built. So I think we mustn't underestimate the need for capacity building. And I think there was a lot of recognition of that during the sessions today.
Excellent.
Alison, can I add something?
Yes, just very quickly, and then we'll start to wrap up. I think this is the start of many conversations to come.
Okay.
But go, Prashanto. Thank you.
Yeah. Thank you so much. Yes, I feel that it's required the integrated approach, not only the installation of the toilet at the household or community level, need to focus on the behavior change. Yes, it's need to involve the local level stakeholder. Like if I consider the Bangladesh context, under the Water for Women program, we are working with the local government institution. Those are the sole responsibility for providing the services at their community level. Also, other stakeholders like Clarissa mentioned that, okay, local sanitation entrepreneurs, those are have the need to develop the skill on the accessible toilet and other available the facilities at the community level. And also the institution level, like the school at the primary and secondary, to strengthening the system at the local level for sustainable the integrated approach and facilitate the local level stakeholders for allocating the budget and implementing the activities. And first thing, they change their behavior. Those are the duty bearer for providing the service to the right holders. Thank you.
Thank you, Prashanto. So I'd just like to, I think we could probably keep going, but we've already sort of gone over a little bit. So I think that's a timely point to stop and let our colleagues in the US and Canada actually get to bed, because it's very late there. And they have another day tomorrow. But I hope this has really given, we've touched on so many different things, and I think that has really sort of flagged how many different elements and the complexity of the sector. But I know as we keep working together, we will work through all of those. But I'd really just like to thank Clarissa and Jan for taking, again, a whole broad suite of things and sort of narrowing it down to a few slides, giving us some food for thought to start this conversation. We've gone off on a range of different directions, but I think that's great. Thank you for, I think, Clarissa and UNC for actually creating the opportunity that we could actually get together and have some of these conversations. And I'm hoping it's something that we can really build on going forward. Thank you to all our guests, Byron, Murali, Prashanto, and Ravi, for all your comments. And thank you everybody else for taking the time to join in, asking your questions. I think, as Jan said, we probably asked ourselves many more questions than we have answers. And I think Murali emphasized that as well. But unless we start asking the questions, we're not actually going to be able to find the answers. So thank you again, everybody. And we have the final one of these sessions tomorrow afternoon at 2 o'clock. So we look forward to seeing you there. And thanks again. If there's any questions, we will try and sort of follow up and get back to you. But definitely go to the website and have a look at the presentations and explore those issues yourself. Thanks again.
Thanks.
Thank
Good
you
night. Good day.
Bye.
Bye.
Thank you, everyone. Thank you very much.
Thank you.
Thanks.
Bye-bye.
Bye-bye.